Hey everybody, we're here at Gastro Primo again to talk about GI anatomy and illnesses. We're in search of a happy belly, and we want you to look for us on YouTube and Facebook in search of a happy belly and Gastro Primo. We want you to subscribe and push the bell if you can. Give us a thumbs up just to recognize that you want to watch our program. And we're trying to deliver some information every week that's helpful for you when you go to see your doctor, and especially if you go to see a specialist. I want you to understand that we're not here offering medical advice specifically for individuals. We're simply providing some information to help with your visits and to give you additional information to use when you go to see your doctor. Today we're going to finish up where we started last week on stomach. And one of the things that I really wanted to clue into tonight was the diagnosis of Helicobacter pylori, which is a bacterial infection that we're seeing a lot of nowadays. And if you didn't know this, back in the 70s, we had Australian physicians who came to the conclusion that Helicobacter pylori was in fact one of the most common causes of peptic ulcer disease. And back then, peptic ulcer disease was one of the most common causes for admission into American hospitals. It was discovered that there was a particular organism that was found adherent to the wall, the mucosa of the stomach, called Helicobacter pylori. And since then, it has gone on to really take a place in the Hall of Fame of gastroenterology, as it has become basically something that we have attempted to eradicate. And in doing so, have seen the incidence of peptic ulcer disease plummet. Back in the late 70s, peptic ulcer disease was the #1 cause of admission into the hospital, and in the top 5 reasons for abdominal surgeries, given the incidence of perforation of the stomach and GI bleeding. So we've really seen a true change in medicine through one little bacterium that was identified and interestingly solidified in history as to a cause of a major medical illness. When we find Helicobacter pylori, and it is prevalent everywhere, we can generally eradicate it with antibiotics along with acid inhibiting medications, and the combination of the two is very effective in excess of 92% to eradicate the organism and therefore prevent peptic ulcer disease, GI bleeding, perforation, gastric outlet obstruction, and the such. With that in mind, we also include non-steroidal anti-inflammatory agents, which also are very prominent in modern medicine as they are used for management of rheumatologic complaints, joint aches and pains, and basically musculoskeletal complaints of all sorts. They're the other significant cause for peptic ulcer disease and GI bleeding, and we see them quite often along with aspirin as the root of GI pathology. So it's really important for you to pay attention when you are taking any of these medicines that you follow the instructions on the bottles very carefully, because they can cause major GI upset. So when we're talking about acid-related illnesses, in particular peptic ulcer disease, but erosive disease, gastroesophageal reflux disease, but anything that has a root in acid, all of these things have to be considered. And it's really important that when you come to see your doctor or your specialist, that you have that at least in your memory, if not written down. It makes a big difference to know that those things are in fact responsible, and it takes a lot of the need for further workup to gather that information and come to a conclusion about what is causing the ailment. Peptic ulcer disease is generally a condition that has some root in epidemiological terms in genetics, because there are certain people who have tendencies to develop ulcers as a result of bacterial infections, and those individuals have to be looked at more discerningly to make certain that if in fact if there is evidence of the bacteria in the stomach, that it be eradicated. Further, it's thought that Helicobacter pylori can set people up to certain kinds of malignant diseases inside the stomach if not eradicated and controlled. We don't see that much. It doesn't happen very often, but it is something that is in the literature, and we refer to it when we're doing our diagnostic workups and management. So eradication of H. pylori is important. Management of NSAID or arthritis medicine induced peptic ulcer disease is an important part of the history that we get. Outside of that, caustic ingestion, accidental or on purpose, can be a certainly injurious part to the esophagus, stomach, and duodenum, both acid and alkaline materials. The stomach does not tolerate wide fluctuations in pH, and therefore you have to be very careful about managing those things when you know about them. It's not that big a deal as long as you stay away from industrial products. For the most part, you don't find acid or alkaline materials and across the counter materials that could injure the stomach, outside of those that have the skull and crossbones markers on them, which you have to be very careful about leaving them around, particularly with small children. It's important that you put those in a place that you guard carefully. So gastric related illnesses have become not so much a problem anymore, as we do have such powerful, potent medications such as the H2 antagonists like Tagamet and Pepcid, Axid, and what we used to have, Zantac. But now with the proton pump inhibitors such as omeprazole and esomeprazole, those kinds of medications are very potent acid inhibitors for the period of time that they're active in the bloodstream. Why proton pump inhibitors work so well is that they actually go to the source of the proton production, which is at the tip of the parietal cell, which is found most prevalently in the gastric antrum and up to the incisura angularis. Those particular areas are where we find most of the acidity and the reduced pH. The grinding effect of the stomach in the proximal portion, or the upper part of the stomach, pushes the food and liquids down into the antrum where the acidification takes place. And at that point, the nutrients are squeezed out of the food particles and made available for digestion once they pass through the pylorus into the small intestine. The antrum is a particularly important part of the stomach. It's the bottom part of the stomach, right down where the stomach empties into the small intestine, and it's there that a number of specialized functions take place, such as preparing iron for absorption in the small bowel, for binding with a protein to make absorption of B12, as well as a few other B vitamins well absorbed into the small intestine. And so those particular parts of the food that you ingest are taken to other parts of the body where they're utilized for very important structural considerations like coagulation, like skin structure, like hair growth, eye development, things that vitamins, particularly of the fat soluble group are important. All of those become available as the stomach grinds and passes materials into the duodenum, where they're best absorbed in the duodenum and in the proximal jejunum. So the stomach is both a receptive organ that gathers materials to be processed, but it also is a pump, and it is necessary to process, grind into small particles, and then pass into the small intestine for absorption. When diseases of the stomach occur, these particular functions can be severely disrupted, and as a result of that, result in malabsorption and malnutrition. We're going to get into that a little bit more in the next discussion. We'll talk a little bit about the duodenum, the bile that comes down from the liver into the biliary tree and the pancreas, with regards to pancreatic juices and enzymes that are responsible for absorption of foodstuffs. It's really important when we talk about bloating and gas and distribution of food materials and air, that we talk about the bottom part of the stomach, the proximal or the top part of the small intestine, and where all of these components come together and become important in causing a lot of the symptoms that people describe. And in addition, we'll talk about bacteria and how they affect both pro and con. There are certain bacteria in the small intestine that are very important in our existence on this earth. And so we don't want to eradicate the good bacteria, but some of the bad bacteria can cause some problems, and we'll talk about that in an upcoming version or two. I just want to keep these as short as possible, cram as much information into each one of them as I can, give you packets that you can place in your compendium so that you can gain access to a specific talk to answer the questions that you might have when you come home from your doctor, or when you consult Dr. Google. We want you to please like and follow us on Facebook and ring the bell, just to show us that you care and that you really are interested in what we're doing. If you can, subscribe. We want the GastroPrimo In Search of a Happy Belly to be the subject you're looking for. And if you can, show us that you want us to keep or to continue on with this. Until the next time, I'll see you later.